So far, the African continent has recorded some 120,000 cases of COVID-19 and just over 3,500 deaths. The United Nations saying that these relatively low figures have raised hopes that African countries may be spared the worst of the pandemic. But if that is true, why? And is it too soon for the continent to be dropping its guard? Well, to discuss this and more, we can speak now with Yap Boum, who's the Yaoundé representative of Epicentre, the research and epidemiology arm of Médecins, Sans frontières. Thank you very much indeed for speaking to us here on France 24. Now, with 5,500 confirmed cases, Cameroon actually has one of the higher infection rates in Africa. How would you characterise the situation where you are?
The situation started 2 or 3 months ago in Cameroon when we had our first case. So since then, we have the two different phases. The first one is when we have the imported case, and then when we have the transmission in the community. What we've seen in Cameroon as compared to a country like Ivory Coast, where you have the case were localized in the capital city like Abidjan. In Cameroon, we have the case all in the 10 regions of our country, which definitely increase the number of cases that we can have, and it's an important challenge. Moreover, because of the challenge, the economic and social challenge, we have had to release the measure. And then since we've opened the bar and restaurant, that was around the 30th of April, we've seen an increase in the number of cases. So now it's a big challenge, especially when we look at the modelization. We are going into the peak, and the peak means that we will be reaching 10 to 15,000 reported cases in the next 2 weeks. So therefore, we really have to take those data in consideration and make sure that we can prevent the outbreak in the community and also in the rural environment.
And how receptive exactly are the majority of Cameroonians to measures implemented that aim to try to stem the flow of this virus?
You know, it's a real communication and sensitization challenges, because when we actually start the lockdown with closing the bar, the Cameroonians have understood that there was something major that was happening. And unfortunately, when we opened them, they have not all realized that it was mainly for economic reason. They consider that the issue, the pandemic that was happening, was over. So now, if we were seeing 1 out of 10 people wearing a mask, like the one I'm having right now, from 4 out of 10, now we have, let's say, 1 out of 10. So we really have to push more and more in the community the message that the mask and the social distancing is still needed, because we are actually going to have more and more cases as we go.
And do you think that's the case for other African countries too? How exactly do you think we should be understanding the relatively low number of cases and deaths in sub-Saharan Africa compared to the rest of the world?
You know, as an African, the question is not whether we have lower cases as compared to the rest of the world. The question for African is how are we going to handle what is happening? We don't have the same number of hospitals. We don't have the same number of respirators as the European and Chinese country has. We have less. So we really have to make sure that we don't go beyond what we are having right now. And how to do it is to prevent. We know from our data who are the people who are the most at risk of developing a severe case of COVID. People with older age, comorbidity, diabetes, and so on. So we need first to protect those people so that we can prevent them, at the same time making sure that the other population have the mask and distancing measures so that we can stop the transmission. Because the 3,000 days that we are talking about, that's already too much for Africa.
Now, we've been hearing around the world that testing for coronavirus antibodies is a key part of tracing the virus and ultimately containing it. How would you characterise Africa's testing capability right now?
So, you know, we actually implement the guideline that we received from the West, WHO and many other bodies. So saying that we have to use PCR, which is the molecular testing, to be able to control our pandemic. However, I was talking about Cameroon, where we have cases in all the different regions. So we have cases in villages and so on, where it's very difficult to have the capacity to do those molecular tests. Therefore, we really need to assess, evaluate, and figure out what are the rapid test, you mentioned the serological, will tell if someone has antibodies, but we also need to evaluate and use the antigen test. Those will tell us whether the person actually has the virus because of the presence of antigen. That will definitely be a game changer on how we can trace the actual people having the virus, and therefore the serological test will tell us where the virus has been spreading. So we have two different challenges. The first one, to figure out who are the people who are having the virus at risk for themselves and for the community, and in the second phase, to know where the virus has been going on so that we can control. But in one way or the other, we have to prevent and to isolate all the people who are the most at risk of developing a severe form of COVID.
But do you think it's realistic that enough people across the African continent will have access to these vital tests? Is that something we're going to be seeing soon, do you think, and how?
You know, do we have to test everyone? I don't think we have to test everyone. We need to have some algorithm and to detect who are the population the most at risk. We have the healthcare workers, we have the vulnerable population. Those ones must be tested because those are the ones most at risk. Then we have to test the other people because we want to stop the transmission. But we cannot afford testing everyone. Therefore, we really have to prioritize. And this is what our government, our Ministry of Health and Center for Operation Emergency are doing currently in Cameroon.
Now, a lot of medical professionals have been warning of the possible secondary effects of COVID-19 on wider medical provision. The fact that access to vaccination programs, for example, has been severely impacted across much of the continent. How much of a worry is that for you?
And it has been taken care in terms of sensitization. In the last speech from our president in Cameroon, he actually highlighted that was quite important, that we should continue the vaccination program because COVID is one thing. We have cholera outbreak, we have measles outbreak that can come in Cameroon and all those other countries. So there is definitely a will. But to be realistic, the means are quite scarce. The means in terms of human resource, in terms of funding, to be able to tackle everything. So we have to prioritize. And to tell you the truth, I believe that this pandemic should be a system, because having the COVID in different districts and so on, we have to go and strengthen them more, which will actually put ourselves in a position to provide a better healthcare. We really hope that that is going to happen.
Yap Boum, thank you very much indeed. Yap Boum, the Yaoundé representative of Epicentre, which is the research and epidemiology arm of Médecins, Sans frontières.